Hi, I am Dr. Saqib Mansoor, and this is my channel, Learning Anatomy. And I have started this new discussion of the spinal cord anatomy in a great detail. And this is a series of lectures on the structure of the spinal cord. In my first lecture in the video, I discussed with you the overall external features and the various divisions of the spinal cord into sulci and gyri. And the second lecture was a very detailed and comprehensive discussion on the spinal nerve anatomy, which was appreciated by you all. Thank you very much for appreciating and liking and sharing all of my videos and adding more and more subscribers to me. So I do need the support for this free annual entry channel. And the third lecture was a very amazing lecture, as the feedback is so far the structure of the gray matter, especially focusing on the laminae of the rext. So that was an amazing one. So various parts of these. And today is another interesting lecture on the white matter structure of the spinal cord. And obviously that spinal cord in the central core, there is, is the gray matter, and gray matter is in the center, and around the periphery there is the white matter. So as we are focusing on this white matter, so this consists of white matter consists of bundles of myelinated fibers that are surrounding the central gray matter of the spinal cord. So they are divided into fiber pathways called tracts. So white matter is divided into tracts. So I will discuss what is the definition of a tract and what are the various kinds of the tracts. Here you could see this is the gray matter, and this is the white matter. We'll discuss further how are these various portions divided over the names of these various portions of the funicula. And this is the other cross section of the spinal cord. Various these tracts are shown into that. Like here, I will discuss in detail. This is the anterior portion, lateral portion, and this is the posterior, with all various labeled tracts into the various funicula. So first we'll learn what are these funicula, how they are divided, the white matter, and this would be a recapitulation from the first lecture, very quick, in a couple of minutes. And this is the name of the tracts. So first of all, white matter has a dorsal funiculus, so the dorsal column. Here it is, this is the where you can see this red laser moving on the right side. That is a dorsal, the lateral, or the dorsal column, or the dorsal funiculus. This is present between the dorsal median sulcus. This is the dorsal median sulcus, and here this is the dorsal lateral sulcus. Here it is. Yes, this is the dorsal lateral sulcus, and this is the posterior median sulcus, and in between these is present the posterior or the dorsal funiculus. Here this is the present these two. This is your posterior funiculus between these two sulci. As we move on, we'll come to this lateral funiculus. This is present between this dorsal lateral sulcus, this, and the ventral lateral sulcus over here, right? This would be there. Okay. So this is the ventrolateral or the anterolateral sulcus. Here it is, the anterolateral sulcus, and this here it is sure the dorsal lateral sulcus, right? Dorsal lateral, and this is the anterolateral sulcus, right? And this whole lot is our lateral funiculus. And the third is the ventral funiculus, and obviously this is present between this anterolateral sulcus and this anterior median fissure. Anterior median fissure. This is the anterior median fissure, and this is the anterolateral sulcus, and this whole lot is the anterior or the ventral funiculus. Right, and this I want to point out again that this is the area ventral white commissure placed between the central canal and the ventral median fissure. Right, this is the ventral white commissure. Of course, there is no posteriorly lying posterior white commissure. So coming to the main today's topic, which is the tracts. What are the tracts? What is the definition of a tract? And what are the various kinds of the tracts? So tracts are named after the masses of the gray matter which they connect. So this tract is obviously white matter and named after the masses of gray matter which they connect. For example, a tract beginning in the cerebral cortex and descending to the spinal cord is named corticospinal tract. Firstly, this is a descending tract. So this is the corticospinal tract. Begins in the cerebral cortex and ends in the spinal cord, corticospinal tract. And similarly, an ascending tract which ascends from the spinal cord to the thalamus is the spinothalamic tract, right? And there is a term, lemniscus, which means a band or a ribbon. It's also used to denote a tract, lemniscus. So this is a picture of the enlarged one of the same various funiculi, posterior, and this lateral, and this ventral. So so definition of a tract is a bundle of the nerve fibers within the central nervous system that serves to connect two masses of the gray matter called a tract or funiculus. This is the repetition. So this is thing. So it has a tract has a similar origin, course, and the termination. Similar origin, course, and termination. So various kinds of tracts: ascending, descending, or intersegmental. Right, ascending from below up to the higher centers, and descending they descend from the higher center to the spinal cord. And the intersegmental include both ascending and descending. So they connect the various segments in the spinal cord or elsewhere. So these are the various tracts. We'll discuss accordingly, right? By dividing into various parts. So ascending tracts, that is, that contained in the posterior funiculus. First of all, we'll discuss the ascending tracts, the names and their layout, where they're lying. This is the posterior funiculus, and they contain the two tracts in the posterior funiculus: fasciculus gracilis and cuneatus. This is the fasciculus gracilis, and this is the fasciculus cuneatus. So there are two tracts in the posterior funiculus. Medially is the fasciculus gracilis, and laterally is the fasciculus cuneatus. And similarly, now with the ascending tracts on the lateral funiculus. This is a lateral funiculus, that is the interior and posterior spinocerebellar tracts. So here they are. This is the interior spinocerebellar, and this is the posterior spinocerebellar tract. So these two, right? Obviously, they go from the this spinal cord to the cerebellum. Obviously, these most of the tracts traverse the your brain stem, and this is the thing. So this is the thing, and again in the lateral funiculus, the ascending tracts more are the lateral spinothalamic tracts. Very important, lateral spinothalamic tract. We'll discuss in the next lecture various tracts and the role in the fibers which they convey to the higher centers, and how they interpret the various transitions. So this is the lateral spinothalamic tract, and then is the spinotactal. Here is the spinotactal, then is the spinoolivary, okay, and then other tract is also the resource tract. So this is also over here. Then in the interior funiculus, what is present over here? The tracts and the interior spinothalamic. This is the most important tract here in the interior funiculus, is the interior spinothalamic tract. So this is the story, and also not labeled is the spinoreticular. And in the posterior funiculus, now they're talking about the descending tracts. This few words were about the ascending tracts, and the nomenclature and the placement in the various funiculi of the white matter. And now we'll talk about the descending tracts. Descending, this is the posterior funiculus, right? First of all, this is the posterior funiculus, not labeled. but they are present the septomarginal tract. This is the descending tract, septomarginal tract. And another one in the posterior funiculus is the semilunar tract, the fasciculus interfascicularis. So these two tracts are present in the posterior funiculus. These are the descending tracts, septomarginal tract and the semilunar tract, which is also known as the fasciculus interfascicularis. And the lateral corticospinal and the lateral funiculus, the descending tracts in the lateral funiculus. So very important tracts are present into that, and you focus into that. These are labeled over here, lateral corticospinal tract. First of all is the lateral corticospinal tract, right? This is the lateral corticospinal tract. Then is the rubrospinal tract. Here it is, the rubrospinal tract. Then is the olivospinal tract, right? Here it is. And then is the hypothalamospinal tract, and then is the lateral reticulospinal tract. Some are labeled, some are not. The labeled and they were the important ones, like this lateral corticospinal tract and the rubrospinal tract, and the third one is the olivospinal tract. These three are important, and they'll be discussed in the subsequent lectures coming very soon now. There was a delay in the lectures, obviously, due to some very personal, reasons. So, descending tracts. So, in the anterior funiculus, what are they? Anterior corticospinal. This is the anterior corticospinal tract. And the medial vestibulospinal and the lateral vestibulospinal tract. This is the vestibulospinal, which are subdivided into medial vestibulospinal and the lateral vestibulospinal tract. And the medial vestibulospinal is the medial longitudinal fasciculus. And then is the medial reticulospinal tract and the tactospinal tract, right? This is the tactospinal tract over here. Yes, here. This is the tactospinal tract. So these are again the labelings you can see. So this is, on this side are shown the right side, you can say, shown the our ascending tracts. These are the ascending tracts. And here are the label on the left side, you can say this is the descending tracts. So you can revise from here. This is the posterior funiculus, contains the ascending tract fasciculus gracilis and fasciculus cuneatus. And in the lateral one, lateral funiculus, there is the anterior spinocerebellar, the posterior spinocerebellar, the lateral spinothalamic tract, the spinoolivary, and the spinotactal tract. These are there. And in the anterior funiculus, the ascending tracts of the anterior spinothalamic, mainly this is the tract as well. So this is the, on this side are the ascending tracts, and here on this side are the descending tracts. Here you could see the lateral corticospinal tract and the rubrospinal tract on the lateral funiculus. These are the descending ones. And also here is the olivospinal tract, and here is this you see, as we move on to anterior funiculus, here we have the anterior corticospinal tract, then is the tactospinal tract, and here's the vestibulospinal tract, the lateral one and the medial one. Lateral vestibulospinal tract and the medial vestibulospinal tract. Medial vestibular tract is the medial vestibulospinal tract is the medial one, and the lateral, this is the you see is your medial longitudinal fasciculus. And this is was the brief discussion of the tracts, the nomenclature and the arrangement. And obviously, as the name depicts, most these tracts go into cerebellum, though these two, posterior and anterior spinothalamic tract, go into the thalamus. Anterior, and this is the posterior spinocerebellar, and this is the anterior spinocerebellar. The anterior spinocerebellar and the posterior spinocerebellar, they go into the cerebellum, and the rest of the these ascending tracts, one by one we can say this is the dorsal column, medial lemniscus system. So the fasciculus gracilis and cuneatus, they form the medial lemniscus, obviously going into the upwards, and they decussate in the the brain stem. And this is the lateral system, and this is the lateral spinothalamic tract. Pain and temperature sensation carry into the thalamus. And then is this our spino-olivary tract going into the olivary nucleus of the medulla. And this is the spinotactal tract, so it's going to the midbrain. And anteriorly in the anterior funiculus there is the anterior spinothalamic tract going into the thalamus. And again, these are the descending tracts. Obviously, the corticospinal tracts come from the cortex going into the spinal cord, and the rubrospinal tract comes from the radinucleus, and the olivospinal tract, the olivary nucleus, and this is the vestibulospinal tract. So you know where is the olivary nucleus, we already discussed in the brainstem, like medulla, and this is the tactospinal tract from the midbrain. And this is again the anterior corticospinal tract coming from the cortex, cerebral cortex. So this is the thing, the various general discussion. We'll discuss briefly the very important tracts in the next lectures very soon. So this is the a concept of the segmental organization of the tracts in the various funicula. Very important clinically to correlate how the disease will form and present clinically. Like this is a layout. This is sacral, lumbar, thoracic, and cervical. This is the cervical, thoracic, lumbar, and sacral, and likewise over here. So this is the spinothalamic tract, and this is anterolateral system, right? Pain and temperature sensation. This is the lateral corticospinal tract, and this is the posteriorly the dorsal column, medial lemniscus system. And this system, spinothalamic is concerned with temperature, pain, touch, and the deep pressure. And this is, dorsal column, the medial lemniscus system consists of the joint sensations, the vibration, pressure, and discriminative touch, the 2-point discrimination. So how this lamination is produced, a very brief discussion, and what is the clinical relevance and the importance of these laminations. So here you could see the anterolateral white column. This is told you anterolateral. So producing laminations from the sacral and lumbar segments, sacral and the lumbar segments. Axons of the spinothalamic tracts are diverted laterally. They are diverted laterally by axons which cross the midline at consecutively higher levels, right? So this is producing a lamination. And on the posterior white column from the sacral and the lumbar segment, there is the axons are pressed medially by axons from the higher segments of the body. So they are pressed medially, the axons, they're pressed medially at the higher center. So the sacral and lumbar are lying in the medial side, right? As these axons are pressed medially. And over here in these segments, sacral and lumbar, axons of the spinothalamic tracts are diverted laterally. So the sacral and the lumbar are lying laterally. So the sacral and the lumbar segments in the these segments are lying laterally, and upper side, this cervical segment, this is lying on this medial side in this posterior column. So this is a more explanation over here. This diversion, the cervical to sacral segments are located from medial to lateral in the spinothalamic tracts. This is the anterolateral system here. This is, you see, these are the points that the sacral and the lumbar are located laterally. And over here, the sacral to lumbar are, in the posterior funiculus, are located here in the from medial to lateral. This is the sacral and this is the lumbar, right? So this is the point. And this is the point, obviously, that if there is a pressure exerted on this side, from the sides of the spinal cord, this is external pressure in the region of the spinothalamic tract. So first of all, the segments which would be affected would be sacral and then lumbar, and if the pressure increases, reaches here, then it will be reflected to the thoracic and the cervical, and this would be reverse or inverse in the dorsal column. And this is if the pressure exerted from the lateral side is only limited to outside, that will first inflict the cervical and then to reach the thoracic, and if the pressure increases, reaches more medially, it reaches the lumbar, and in the end it will reach this sacral. So this is inverse in the this posterior column as compared to the this anterior and the anterolateral system, right, in the spinal cord, obviously. So the sensations I told you, these are represented over here are the this temperature, pain, and the touch, and the deep pressure, and this is the joint sensations, vibration, pressure, and discriminative touch over here. So clinically interpreting various diseases will get easier by this lamination concept. And as we'll discuss the central cord syndrome, this relevance would be very, very important, and then some other clinical conditions. So with this, I thank you very much. This was a relatively brief lecture, just introducing what I told you, the tracts. There is layout in the white column, and in the next lecture we'll be trying to sum up very soon the important ascending tracts in the next lecture, and then the important descending tracts in the next lecture, and then also we'll discuss the blood supply. The coming 3 lectures would be coming very soon, and with this I wish you very well. And the concept of our online teaching is getting more and more important in the second wave of the COVID-19. Stay safe, stay home, and learn home. It is better option, and this is I told you in my lecture on my second wave of the coronavirus. This is channel on the learning anatomy. Goodbye.